Well, good afternoon, everybody, or good morning, depending on where you are in the country. My name is Garrett Schmidt, and I'm the managing editor for VBC Exhibit Hall. So, thank you all for joining us for today's live webinar hosted by DataLink, and it is called Establishing Your Medicare Advantage HEDIS Strategy for the Year. Very excited to hear about this topic. We've got a big audience today. Well, we got a lot of an outpouring of interest on this one. So very excited to hear from our speakers today, and I'll introduce them in just a moment. A couple items of note before we get started. This is a traditional webinar format, so this is, you don't have to worry about muting your microphone or turning off your camera or anything like that. We can't see you or hear you. However, we do want to hear from you, and so we're going to have a time for a Q&A towards the end where you can ask your questions to any of our speakers or just in general. And the way you do that is with your control module, there's a place specifically for submitting questions. So go ahead and ask your question there at any time. You don't have to wait until the Q&A to do that. So go ahead and drop it in. We're going to get to as many as we can. If for some reason, again, because we have a big audience today, if for some reason we don't get to yours, don't worry. Someone will reach out via email afterwards and make sure they connect with you. And finally, the session today is being recorded. And so what's going to happen is when we're done, you'll receive an email, maybe an hour or so after we conclude. And it will have a link to the recording and also where you can download the slide set from today. So you'll have access to both of those things. Also wanted to let you know there is a handout available that's going to go along with today's session. So you should be able to see that as well in your I guess in your materials. There's like a little paper clip. Should be, I don't know exactly, your view is a little different than mine, but if you can't find it, I'm happy to send it to you later on. Without further ado, I wanted to briefly introduce our speakers today. We have, and these are all, by the way, from DataLink's value-based care team. And first of all, we have Michelle Magnus, and she is a value-based care manager, and she is a health plan contracting specialist. So looking forward to hearing from her today. Also, we have Sarah Fitzharris, and she is a value-based care manager as well, and she's a nurse and is highly experienced in quality and clinical operations. So welcome, Sarah. And then finally, we have Yasti Puig, and she is a certified quality and coding subject matter expert, and she's also value-based care manager. So we've got a lot of experience on the line today, and excited to hear from these ladies. So welcome to you. We wanted to get started, however, with a polling question for the audience, just to kind of get to know you a little bit better. So I'm going to pull this up on your screen. You will see. Let's see, let me go launch. Okay, now you should see this on your screen, and then just go ahead and select one of these. This is just kind of select one only. Some of them are select all that apply. This would be a select one only. We'll give you guys just a minute for that to come in. Should be pretty straightforward. We're going to have several of these within the session today. So, and this is kind of the format, and then and it is anonymous, by the way. So don't worry, your colleagues aren't seeing it. And we're going to share the results here shortly, and so you'll kind of see where you stack up among your colleagues that are on the line today. Okay, we still got answers rolling in. Again, we have a big audience, so I'm going to shut it down in about 5 long seconds. We'll go 5, 4, 3, 2, and 1. And I'm just going to go ahead and shut this down. And oh my goodness, I can't shut it down because questions keep rolling in. Here we go. I think they're mostly in. So go ahead and shut it down here, and we'll share the results. Okay, so you should be able to see on your screen the results. And ladies, I don't know if you wanted to respond to this or what you thought of our audience today.
Yeah, thanks, Garrett. I'll go ahead and take it from here. So it looks like a majority of our folks calling in are from a provider organization. So that's great. No matter where you're calling in from today, I think you'll find valuable information in the webinar. So let's go ahead and get started. My name is Michelle Magnus. I'm going to go ahead and kick us off by going over our objectives for today. So we're going to start the webinar with a quick overview of key quality components of a value-based contract with a focus specifically on Medicare Advantage. We're going to discuss how HEDIS measures relate to your patient health outcomes, and we're going to share some planning and strategy ideas for success. Next slide. So the first thing I am going to cover today is a Medicare Advantage plan, who offers them, and how they get rated by the Center for Medicare and Medicaid Services, also known as CMS. So CMS contracts with entities called Medicare Advantage organizations, or MAOs. These MAOs offer Medicare Advantage plan coverage to Medicare recipients. And some examples of MAOs are Aetna, Blue Cross Blue Shield, and Humana, just to name a few. Medicare recipients can either choose to have traditional Medicare, or they can pick from a Medicare Advantage plan. These Medicare Advantage organizations, or MAOs, build Medicare provider networks through what they call Medicare Advantage provider contracts. And Medicare Advantage plans are also graded annually by CMS on their performance through what's called the star rating system. And next slide. Thank you. I just mentioned that CMS rates the Medicare Advantage plans on the star rating system. So here on the left, you'll see an example of how a star score composition might look. Some of the categories and percentages that CMS might use to compose that total score. Today, we're going to focus just on the HEDIS section, which is often referred to as quality, and we're going to offer some bonus content about the pharmacy section. So these two areas can make up quite a large portion of that total score. On the right here, you'll see a very high level example of who contributes to that Medicare Advantage plan score. You can see at the top that the work that individual providers are doing directly contributes to the health plan success. So keep in mind, CMS is not rating individual providers, but the health plan might calculate a score for the provider or the provider group. Those scores from the health plan often impact additional payouts in value-based contracts. So you might be asking yourself, well, why is the star score important? Well, Medicare Advantage plan scores are publicly available, and the plans also could risk losing their contracts with CMS for low performance. One other important thing is that if a plan has a high score, they might be eligible to get Medicare enrollment all year versus just getting Medicare enrollment during that Medicare open enrollment period. And next slide, Lori. Thanks. We just talked about Medicare Advantage plans and how that star score from CMS can either have implications or rewards for the plan. So I want to talk a little bit about the importance of a value-based contract and why Medicare Advantage plans may promote value-based agreements within their network. So value-based contracts are really just agreements that are tied to specified measures of effectiveness and appropriateness. In this type of agreement, providers are not getting paid just for the services rendered, so the number of services they provide. Rather, they're getting paid for value that they offer. So to promote success for the plan, including that better star score, health plans will incentivize providers with additional earning through value-based contracts. Next slide. Because it's important for Medicare Advantage plans to perform successfully, they will include many different levers in their VBCs to promote things like proper utilization, improvement in risk adjustment, and better star scores through quality metrics. These here on the screen are just a few examples of the levers in these type of agreements, but they can vary a lot from plan to plan or from provider group to provider group. So health plans or the providers, they might need to adjust these levers according to their specific strategies or focuses. So we really could talk for hours and hours about these different value levers, but today we're going to focus just on the quality component. Specifically, we're going to talk about HEDIS and Part D measures. These additional incentives that the health plans pay in those value-based agreements are pretty much always contingent, or almost always contingent, on meeting specified metrics, including the ones you see listed here. And next slide, please. So this is a very high level example of how quality performance can impact your value-based contract payout for Medicare Advantage contracts. So an important thing to remember, I just mentioned that there's many different types of value-based contracts. This is just a very high level example of how a plan might score and pay out a provider or a provider group. So again, quality is just one lever in that value-based contract, but it's going to be our main focus for the remainder of our webinar today. You can see here an example of a possible quality measure payout that a health plan partner might offer to a provider group. You can see if you look on the left in that second and third column in 1-star and 2-star, there's no payout because that's considered low performance. But as you move to the right and the star score goes up, the payout also goes up. In this example here, I just highlighted a hypothetical provider performance where the provider is earning $7 PMPM. But all the way to the right, you can see those 5-star scores. The total payout is $22 per member per month. So this provider is actually leaving $15 per member per month on the table. At the bottom here in that footnote area, you'll see this is an example of what it might look a payout for a group with 1,000 members. So in this scenario, this provider group with 1,000 members, they earned $84,000 for their performance, but they left $180,000 on the table. So the point that I want to drive home is that your quality performance can have a large financial impact on the payout in your value-based contract. Don't forget, though, that the work that you're doing with HEDIS and Part D measures also directly impacts your patient outcomes as well. And next slide, please. So before I pass the baton over to Sarah and Yasti, I do want to end with a couple of tips for success in your value-based contract. The most important thing is know your contract. Make sure it's available to your support staff and your providers. Identify those value levers in your VBC contract. Understand the metrics that you're being scored on and weigh the impact of each metric on the overall payout so that you know where to focus the greatest reward. You also need to strategize accordingly and choose the right VBC for your organization. So remember, again, the work that you're doing at the practice level impacts your payout in your value-based contract, but it also impacts that star score success for the Medicare Advantage plans. So I am going to go ahead and turn it over to Sarah to talk more about the specific measures and how those measures impact patient health outcomes. But before I turn it over, we are going to have another polling question. So you should see that polling question
Oh
here.
boy. Okay, here we go. So another one, same as before. If those of you who are just joining us, you're going to see a question pop up on your screen here. And go ahead and select these. How knowledgeable are you of your Medicare Advantage contracts in terms of quality incentives? And again, this is anonymous, so don't worry about that. We're just we will show you the results, and you'll be able to see kind of where you stack up among your colleagues. So no shame in if you're not aware. That's kind of why we're doing this. But yeah, we'll give it another minute or so for folks to answer. Okay, and this is a select one. That applies. Okay, it looks like most of the responses have come in here now. So we're going to go ahead and close it down in about 5 seconds here. About 5, 4, 3, 2, and 1, and then we'll show you the results. Okay, are you guys able to see the results?
Yeah, we are. And thank you everyone for participating in that poll. It's nice to see a good mixture of answers there, but really good to see that a lot feel that they're very knowledgeable and already have strategies that are planned accordingly. Hopefully, if that's not the case, then the discussion that Michelle has provided so far has prompted you to want to learn more about your contracts. We are going to go ahead and shift discussion now to the clinical aspect of HEDIS. And most of you are probably very familiar with HEDIS and understand that it consists of a set of standardized performance measures that were developed by NCQA, which is the National Committee for Quality Assurance. And it is a tool that is used by 90% of US health plans to measure performance on important dimensions of care and service. More than 190 million people are enrolled in health plans that report quality results using HEDIS. Because so many health plans use HEDIS and because the measures are so specifically defined, HEDIS makes it possible to compare health plan performance on an apples-to-apples basis. And HEDIS measures are based on published clinical guidelines and scientific evidence. NCQA is continuously reviewing these guidelines and then making updates as new evidence becomes available, which is good. You know, a lot of times we actually view HEDIS from the perspective of the provider and payer, right? Because through HEDIS, we're trying to ensure that the work being done in relation to clinical metrics is also being captured and reflected, especially when you're thinking in the terms of a value-based contract. Michelle covered some really useful content about how quality components and scores can affect the financial bottom line for both the provider and the payer. But it also is very, very important to look at HEDIS from a clinical perspective, because when emphasis is placed on the fact that this is evidence-based care for disease management and prevention, it helps to shift our focus back to the patient. And that's what's most important. We're trying to reach optimal care, which takes us to the last two bullet points on this slide, which are that HEDIS assists in identifying gaps in care, so programs and interventions to help increase compliance can be put into place with the goal of improving health outcomes and reducing the cost of care. Next slide, please. There are a lot of HEDIS measures out there, which I'm sure you're aware of, but our focus today will be related to Medicare Advantage. HEDIS measures address a wide range of health issues, but since we are focusing on MA today, I would like to take a few moments to highlight some of the health issues for this population and the measures that correlate, starting with cancer with a focus on prevention. Screenings for both breast cancer and colorectal cancer are part of the HEDIS set. Care for older adults, in which the focus is on functional status, reviewing medications, and pain assessment. Diabetes, which hones in on A1C, and kidney and eye health, which you can see in the checklist to the right here. Heart disease, looking at blood pressure control and statins for patients with CVD. Medication management. There is a lot of emphasis on medication for this population, with multiple measures consisting of medication reconciliation, addressing medication adherence, basic medication review, because the hope is to ensure therapeutic outcomes and then reduce the risk of adverse events. Transitions of care, so what has occurred for the patient through the cycle of hospitalization from admission through discharge, and then also engagement within 30 days post-discharge, ensuring that there is ongoing support for the patient. And then, of course, you know, this list isn't all-inclusive, but hopefully it does help to paint a picture of the value in these types of health issues being at the forefront of care for this specific patient population. Next slide, please. So how do we incorporate processes that capture everything that we need to provide the best possible care for our patient? And I think that all begins with a team-based approach. In just a few minutes, my teammate Yossi is going to take you through for a walk through some in-depth ideas related to clinical strategy. But before she does that, I would like to touch on the significance of team-based care and then provide some recommendations to help you get started with that. Beginning with teamwork. Communication and teamwork skills are essential for providing high-quality care. Research shows that when clinical and non-clinical staff collaborate effectively, healthcare teams can improve patient outcomes, they can prevent medical errors, improve efficiency, and increase patient satisfaction as well. One of the most effective means of collaboration is to utilize your staff to the full extent of their scope. So getting everyone on the team involved in the patient's care. And we can utilize our team to assist with things like creating templates within the EMR, especially for extended visit types. The AWV comes to mind initially when I start to think of templates and building those out, or ones that have certain components that need to be captured during the visit. One thing that a lot of provider groups that I work with are doing now is that they are rebuilding the templates that they have in place for patients with diabetes to ensure that they're ordering UACR testing for KED, because reviews showed that they were ordering the CMP regularly for these patients, so they were easily capturing the EGFR, but they were forgetting to order the UACR component. So don't just build and utilize templates, but be sure to update them as requirements change. Developing screening and standing order policies. This helps to cut back on some of the back and forth between the support staff and the provider, and it also helps to avoid missed opportunities. If a patient is interacting with a nurse or a care manager, go ahead and take care of the testing that they need at that time. Utilizing a screening tool or questionnaire to help identify and address social determinants of health barriers. And remember that this may need to be a conversational screening. It will depend on the patient, of course. How is their food security? Is their diabetes or blood pressure uncontrolled because they don't have the means to support a healthy diet? Are they non-compliant with preventive screenings because they don't have reliable transportation? How is their health literacy? Do they understand what you're asking of them, or do you need to present it in a different way? Really get to know your patient. And that takes me to patient education, because in really knowing them, hopefully you'll be able to determine what education style works best for them. Are they an independent learner? Are they a visual learner? Are they someone who needs to work one-to-one with a care manager in order to understand? We can't expect patients to be active participants in their care if we aren't presenting things in a way that they can understand. And then patient outreach and persistent reminders. I'm going to tie those two things together. Outreach, of course, is a necessity, but we all know that sometimes that's not as easy as it sounds, and that's where persistent reminders come in, or a variety of approaches to outreach. So developing an outreach program that incorporates texting and email campaigns, the use of a patient portal, and even mailers in some cases can provide an added benefit. I'm going to go ahead and hand things over to Yasi to review some of the things that we've covered so far and then dive a little bit deeper into strategy.
Thank you, Sarah. All right, so before we begin looking at some of the ideas to build this strategy, let's just do a quick review. When it comes to strategy, there are a few things we have to remember. Number one, as Michelle mentioned, you must know your VBC contract. We can't build a strategy without it. So what measures are you being monitored on, and what are the requirements for submissions by that payer? Also, we got to think about the patient, as Sarah mentioned. Quality is about addressing or preventing important health issues. So always remember that each number actually represents a patient, and the better care we give, the better our numbers will be. Sarah also talked about patient outreach and persistent reminders. To me, one of the most frustrating parts of VBC is non-compliant patients. So in order for this strategy to succeed, you must have a follow-up and recall plan. Consider implementing a schedule before they leave policy, as Sarah mentioned, to make sure that those tests are scheduled. But also, you have to have a way to ensure that you receive their results. When I used to work at a PCP's office many moons ago, I used to have a paper tickler system. So when a patient got a referral, I would put it out for 30 or 60 days so that I could go ahead and make sure that I got the results back, but also to make sure that the patient even went to have that test done. Now you have many electronic ways to do that, but if you don't, then again, consider the paper system. It might be beneficial. Sarah also mentioned teamwork and how it's important to involve others in the process, from front desk to clinical staff to the providers. But to me, I find that many organizations kind of forget the important role that the billing and coding staff can play. They truly can be for you the secret weapon that can help move that needle on those scores with the use of CPT2 coding and the chart reviews, of course. It is one of the reasons we actually created the clinical care gap report. So Laura, if you'll go ahead and show that next slide there. Since coders can identify documentation during their chart reviews that can help close gaps, providing a report that actually gives you both the MRA and the HEDIS all in one is key. This can also help for them as a query form where they can give it to the provider so that they can address all the gaps in care while in the room. But regardless of what billing process you use, it is really important that you have some kind of CPT2 code cheat sheet. This has been very beneficial for offices that I know are using it. They usually have it both for the providers and the billers. It's just an easy way for them to know what CPT2 codes to submit that will close those gaps in care for things that might have already been taken care of. Okay, so now that we have the foundation in place, let's just talk about the how. Let's build our strategy and go from reactive to proactive. So first of all, in order to build that strategy, we must understand those MA measures, right? So if you'll go ahead and go to the next slide there, Lori, sorry. I'm just going to use breast cancer screening here as an example. Every measure really has four parts that we must know. Number one, we must know their eligibility. Who qualifies for this measure, right? Which actually puts the patient to be in the denominator. Then we've got to know the requirements of that measure. What needs to happen in order to close that gap? So what test needs to be done? How often does it need to be done? Does the results matter or not? Number three, you have to know who and how can the patients be excluded from this measure. And then finally, if the test is done, how would I then report it to the payer? These are four components that you need to truly understand before you can move on to the next step of creating a strategy. Obviously, we won't get into all the details of every single measure. It is impossible for today's webinar. But not knowing this information and educating everybody involved in the process will definitely hinder your ability to create a successful strategy. So education and communication must be at the center of any strategy approach you choose. You know, the BBC team works one-on-one with many provider groups to help them strategize and close gaps in care. And I am always so amazed at the lack of information they have about the measures and how to close them and all of that. So one of the first things we do is usually aim to do a full HEDIS education for them so that they know exactly what needs to happen in order to close those gaps in care. So if you're a payer, think about creating a complete resource guide that can and make them available for them online. Also, think about providing quarterly webinars. There is so much turnover usually in doctors' offices, of course, and in the health industry as a whole. So providing that continuous education will ensure that those that need to do the work know the information in order to carry it out. If you're an engagement manager, think about discussing the measures in depth during every one of your calls and even providing them those flyers. If you're a provider group or a practice administrator, think about discussing them during staff meetings and having office monthly focus or themes, which we'll get to a little later. If you're a vendor, think about creating blogs, newsletter, or webinars, as some of the ones we have available actually in our website, and I've put the link on there for you as well. Now, Sarah will be talking a little bit about the process of planning, but before she does, we have one more polling question. So, Garrett, if you want to show that one.
Okay, here we go. I'm going to put this up now. How well do you understand Medicare Advantage HEDIS and pharmacy measures? Again, this is anonymous, so don't feel bad if you don't, but we're going to show the results and you'll be able to see kind of where you stack up among your colleagues. And again, it's anonymous, so just choose the one that most applies to you, and we'll share the results in just a moment here. Okay, and it looks like most of the questions have come in, or responses have come in, but looks like they're still coming in, so just give it just another few seconds here. All right, so we'll give it a 5 count here, and then I'm going to go ahead and shut it down. So 5, 4, 3, 2, and 1, and then I will share the results with you. Okay, are you guys able to see the results?
We are. Thank you, Garrett, and thanks everyone again for participating. It's good to see that Most folks at least feel comfortable with the measures and know enough about them to discuss them with others. Hopefully, we'll be able to teach you a little bit more as we move through, and what we continue to discuss will add value. So we can move on to the next slide, please. Okay, so what we have here is an overview of planning and how it should be a continuous cycle. My approach to clinical planning in relation to HEDIS is based on a combination of the experience that I have working as an organizational director of quality and the experience that I have as a performance improvement consultant. So from being on the inside and then being from being on the outside looking in. We heard earlier from Michelle about the importance of understanding your value-based contract. So before anything else, we need to start with what our contractual agreements are. Are they related to performance measures, visits, or are there other components? And then once we understand that, it's imperative to assess past performance in those areas because looking back helps with the next step of the cycle, which is to identify our areas of opportunity. From there, we have the ability through brainstorming and predictive analysis to set goals. I do want to emphasize here how advantageous it can be to utilize a data-driven population health tool to assist in assessing past performance, identifying opportunities, and setting goals. And we'll look at that together over the next couple of slides. After we have our goals set, then we need to strategize. Yossi is going to go in much more depth in relation to strategy in just a few minutes. But once our strategy is in place, we need to implement processes that we believe will lead to the achievement of our goal. And then finally, we need to examine the results of the processes that we've put in place. We need to do this on some sort of cadence as well, because if things are moving along as expected and we're satisfied with the results, then great, that's awesome. But if there are adjustments that we need to make sure that we have enough time for those changes to make an impact. So we should continually move back and forth through these steps as needed throughout the year. Next slide, please. And here we're going to take a quick look at how a pop health tool can really be your friend when it comes to assessing past performance, identifying areas of opportunity, and setting goals. Let's build a scenario that our VBC contract has an annual wellness visit completion component of 50%. We're able to assess our past performance through the use of our Evoke 360 office visit summary, and we note that our AWV completion rate in 2023 is currently weighing in at 40.5%, which we can see is an actual drop from the 43.5% that we achieved in 2022. This is certainly an area of opportunity, beginning with identifying why the rate may have decreased over year, and then moving on to pulling up and reviewing the list of patients that we failed to see for this type of visit and so forth. Then we would want to set some goals and then move into building our strategy. Next slide, please. Now we're going to look at our HEDIS reporting in a similar way. When we assess past performance, we see from the HEDIS summary that we were at 3 stars and below the prior year for breast cancer screening, COA pain assessment, and colorectal cancer screening. We recognize these as areas of opportunity, first because we aren't satisfied with the star level that we achieved on these measures, and then second because we can see from the reporting that improvement on these measures should be attainable based on the number of patients we need to bring into compliance to reach the next star level. Of course, this conversation leads to setting a goal of achieving at least 4 stars for each of these measures. And then, of course, also improving the number of patients that we're caring for. We also discuss how ordering preventive screenings and assessing for pain are components of the annual wellness visit. So we identify this as an opportunity that overlaps with the AWV goal that we talked about on the last slide. And we utilize the HEDIS detail report to identify patients who were not compliant for these measures last year. And then we plan a push to schedule their AWVs as early in the year as possible. So as you can see, the combination of just a couple of reports aided us in all 3 of those steps in our process. Now I'm going to go ahead and hand things back to Yasti to talk about building a work plan.
Thank you, Sarah. So Robert Collier once said, being successful is the sum of small efforts repeated day in and day out. So before we get to great ideas on how to do that, we first need to come up with a work plan. Because if we're going to have great ideas, we're going to need to know when to do them, right? So let's kind of work and build this plan together. Okay, so first, you want to list the measures in your contract, or maybe just the measures that you want to focus on. It doesn't necessarily have to be all the measures, but you want to kind of have a plan on when you're going to do what. Okay, so I have listed the measures here on the left, and then across the top, maybe list the months and think about the national or even your payer initiatives. One of our clients mails out fit kits in the middle of the summer. So if I was part of that plan, I would definitely list that there because I want to take advantage of anything that maybe the state is doing to promote that, or maybe what the payer is doing to promote that and take advantage of their flyers and mail outs, right? Then I want to think about taking a bite-sized approach. So on the bottom here, I have listed a few other things that we can focus on, such as annual wellness visit, as Sarah had mentioned. Maybe think about changing those 30-day prescriptions to 90-day scripts, and so on and so forth. Okay, so I've listed a couple of ideas there for you. And again, this is the one flyer that Garrett mentioned at the beginning that you can actually get from clicking on that little paper clip on your go to webinar there. Then we also want to think about what to target first, okay? And we want to set a goal. Where do we want to be? By the end of first quarter, maybe think about how many patients I need to, call and get scheduled and get in so that I can accomplish that percentage that I'm looking for. Then we have to just plan it out. What measures do I want to focus on and when? Put a plan in place and make sure that you communicate it. It would be a great idea if you come up with something like this to maybe print it out, have it poster size, post it in the office so that the whole staff are all into the idea of what we're doing. Okay. Remember, if you fail to plan, you're going to plan to fail. So you want to make sure that you have some kind of a plan in place. But don't be overwhelmed by this, okay? It looks very complex. We've done it for you. You just got to tweak it if you would like. Don't be overwhelmed. This is meant for you to just look at the areas where improvement is needed, put a plan in place, and have something to improve it. So maybe you're doing really well with some measures. Maybe you just need to focus on a few of them. Hopefully this gives you an idea on how to do it. Okay. As I mentioned before, and I think I think Sarah might have mentioned too, quarter one is really essential to setting up your team for success. And this is that time of the year. We are in quarter one. Now, you may still be cleaning things up from previous year while you're still trying to plan for the new year. And unfortunately, we don't always get the information on those gaps in care from the payers or the MSOs, maybe sometimes even after quarter one. So we're going to talk about some of those things that you can do to kind of get a head start on things. But before we do, we have one last polling question for you. So Garrett, if you want to show that for us.
Okay, yeah, we do. Here we go. Launch. All right, so you should see this on your screen now. How do you address the quality gaps for your members? Okay. And we'll give you guys a couple seconds to answer. And again, this is, as I keep saying, this is anonymous, so it's just so you can see where you stack among your colleagues, and we'll show you the results here soon. All right, and this would be kind of a choose one only, as opposed to all that apply. So we've still got a few results coming in, but I think most people have answered at this point, so we're going to go ahead and shut it down in another 5 seconds here. So 5, 4, 3, 2, and 1, and we're going to go ahead and share the results now. Okay, are you guys able to see the results?
We are, and that's great. We're among very strategic folks here, so that's really really good to see. Um, I, I can't think of anything better than having a team that's focused on gap closure. Hopefully, the content that we've covered so far has you thinking even more about your approach, and hopefully, we're providing some valuable ideas for you all. And we can go ahead and move on to the next slide that we have. So we've talked about shifting our mindset from reactive to proactive, and we've touched on most of the elements already that are listed on this slide. Quarter one, again, is the optimal quarter for planning because a productive first quarter ramps you up for a successful year. And again, it all starts with knowing your contract and then reviewing performance. As Yasti mentioned, it's often a few months into the year before we have viable data to work with for the current measurement year. But that doesn't hinder our ability to learn from our past performance and to strategize based on that. What are our areas of opportunity? Are there some providers who are performing really well in those areas that can share best practices? Through research and team-based discussions, can we generate ideas for process improvement? And then implementing workflows that will maximize our potential to reach our goals. In Q1, we can also take an aggressive approach to gap closure because if we accomplish more early in the year, it definitely lightens the lift that we have in Q3 and 4 when things get so incredibly hectic. So get a jump on things with earlier focus on preventive screenings and diabetic testing and things of that nature. We can also review our population for exclusions and ensure that if they do meet exclusion criteria, that we have that documented and appropriately coded. Let's also concentrate on patients who failed compliance for measures like A1C and blood pressure control early in the year. Ensure that they're scheduled for a visit early and then provide education and resources that can assist them with managing the condition. Yasi, can you pick up with the patient education and medication adherence pieces?
Yeah, absolutely. For patients that actually qualified the previous year for that FMC measure, that means that they had multiple chronic conditions and they went to the emergency room. And maybe even those patients that actually had an inpatient admission or readmission the previous year. It is great to look at those patients that fell into that denominator and maybe create some kind of outreach campaign. You want to educate them and tell them to please call the office before they go to the emergency room or before they go to the hospital, and if they do have one of those events again, to make sure that they actually call the office right after so that you can bring them in for an office visit and to do the medication reconciliation. We find that as much technology as there is out there and as much HIE information that people are getting in for FMC, that seems to still be a little bit of a problem. Not many doctors' offices get notified that the patient has gone to the emergency room. So, really, your first line of defense is probably going to be to ensure that the patients are actually calling you when those things happen. So, just kind of alerting them and putting that in their head to make sure that they're calling. We're also going to talk a little bit about med adherence here, excuse me, as a bonus. This is probably the one area that most groups struggle with because these are really hard measures to do well on and they are triple weighted. So, think about what reporting do you have available? Think about having an outreach plan. What resources is the payer providing for you? And maybe try to find out why the patient was not compliant. I am currently my mother's caretaker. And one of the things that have really helped me with having my mom make sure that she takes her medication is buying her an Alexa. I have scheduled Alexa to remind her of her medications 4 times a day, and that has been my secret tool. Yeah, Alexa reminds her so that I don't have to. So, to me, the secret is finding the why. Are they forgetting? What's happening? Why are they not taking their medications? And once you find the why, then you will be able to find maybe some solutions for them. So, in the appendix of this PowerPoint, we've actually given you some ideas of some of the things and some of the most common reasons patients fail med adherence. Right. So, if you want to go ahead and go to the next slide here. So I want to tell you a few things that I have found to be really helpful when measure gap closure. We know that we need to order a test, the patient needs to complete it, then it needs to be documented and it needs to be reported. This will be the perfect scenario, but we know that the process can break at any time. We may forget to order the test, or if the test is ordered, the patient doesn't complete it, so on and so forth, right? So before we order the test, though, we need to know if it's needed or not. So, how will you find this out? As Sarah mentioned, make sure it's on your questionnaire. Put it both on your new patient questionnaire, your annual wellness visit questionnaire. Make sure that there's a preventative medicine section to ask about their breast cancer screening, their colorectal, and their eye exams. Remember that these measures can also be patient reported. So there's no need for you to be going to hunt down a colonoscopy report from 5 years ago. Just asking this information on the questionnaire will help you document it in the EMRs. Okay, and talking about EMRs, make sure that your EMR templates have a dedicated area for this information. You have no idea how many times I have gone into a patient's chart to do a chart review. I see that the patient documented on the questionnaire, but nobody brought it into the EMR because there's no place on there to remind them to do that. So just look at your templates and make sure that that is the case. Also, if a member declined having a test, make sure that you have a way to think about those advanced illness and frailty exclusions. As I'm reading a chart, the moment it says patient declined having a colonoscopy, my brain goes, okay, wait a minute, are they 66 and older? If they are, could they possibly qualify for the advanced illness and frailty? Do they have some of those common conditions, your CHF, emphysema? Do they have any weaknesses or such as abnormality of gait? I'm sorry, if do they have any frailties, I should say, such as weaknesses or abnormality of gait? I find that many times these things are documented on the progress notes, but not reported. So think about those frailties that need to be reported and recaptured. Also, think about those measures where the results does in fact matter. Make sure that they're captured appropriately. And if in fact, you have to order those tests, try to do it early in the year, of course, not at the end of the year when the mother-in-law comes to visit and there's lots of desserts happening that's going to throw off those results. And don't forget your time frames. The worst thing that I see happening is when things are done, but they're actually done out of time frame. For example, your OMW have 180 days for that patient to have that bone density scan done, and they do it on 181 days. Keep a look on those time frames and make sure that they're done during the correct time frame. Don't assume that the patient completed the test. Close the loop. Make sure it's documented and reported appropriately. One of my favorite quotes from Maya Angelou is at the end of the day, people don't always remember what you said, but they will remember how you made them feel. So don't make them feel you're just checking off a box. Show them that you really truly care for them, and that is the reason why you're ordering those tests for them. Hopefully, though, we have made you feel inspired today as well. Now, I don't know about you, but if something or someone makes me laugh, I will usually remember them. So, in the next few slides, we wanted to share just a few creative, memorable, fun, and unconventional ideas that may help you. And we have actually found to be successful for other practices. These ideas will help to create momentum and excitement for the staff and ultimately help you close gaps in care. But I gotta say, don't limit yourself to these ideas. You know, Incorporate your team in them and allow the staff to come up with those ideas. You will be surprised at what they come up with. So for breast cancer screening, partner maybe with local facilities to organize some kind of on-site theme events. One of the groups that we work with actually had a Mardi Gras party where the theme was that because you flashed them, you got Mardi Gras beads. This made it fun and it was very effective. This group actually ended as a 5-star for breast cancer screening in 2023. Think about maybe having a local facility provide posters where there is a QR code where the patient can just scan it and go directly to their scheduling app. Think about having breast cancer videos in the waiting room. You never know how one of these things can maybe encourage a patient that might have been reluctant to have a test done. And that can possibly prevent them from having breast cancer. I'll never forget the story of Amy Roback, the Good Morning America correspondent. She was actually diagnosed with breast cancer after undergoing an on air mammogram, and she was just doing it to encourage viewers to get checked. So you never know how you can actually have an impact on those patients. Um, the next slide is going to talk to you about colon cancer screening. This one is very dear to my heart. My brother in law actually passed away at the age of 50 from colon cancer. He was diagnosed at the age of 47. NCQA is actually adopted, 45 years old. We're hoping that at some point CMS will do as well, because this can really prevent some patients having colon cancer. But again, involve the staff, decorate the office, have them wear shirts, partner with a local lab to have test kits in the office to hand out to the patients. But I tell you what, be creative with it. If you just hand them a test kit, maybe it'll get over to their desk and they won't think about it much. But what about if you create a little bag like this and you put a little bit of toilet paper in there or some wipes and you stick that fit kit in there? I think I would probably keep this on my desk and remind me to do it, more so that if I just had the kit laying on my desk. So just have fun with it, but kind of like incorporate other ideas into it. Use technology, set up a texting or email campaign, use those little poop emojis, make it fun. And we have even heard of some organization renting those inflatables walk-through colons for health fairs. So look in your area and see if that's something that you can do. And lastly, for your diabetic patients, maybe host a sugar-free party to have on-site testing for those A1C, that KED, as Sarah mentioned, the EGFR and the UACR, as well as eye exams. Make that worth their time. Maybe even bring a diabetic educator, a nutritionist. What about a chef that can actually show them how to cook easy, healthy meals, and hand those ideas out during the event? Also, set up text reminder campaign during important holidays. I've put a few funny ones out there for you guys to utilize. Again, I don't want you to be overwhelmed with all this information. Just pick one or two measures that you need improvement on, pick one or two ideas that you want to try, and have fun with it. All right. So now, in a quick summary, and I'll hand it over back to Garrett. In order to create a strong HEDIS strategy, number one, you must know your contracts. Number two, stay patient focused. Number three, understand your measures. Number four, align with your national and payer initiatives. Set a goal, plan for it, involve the team, take a bite sized approach, and create a follow up or recall workflow to ensure patient compliance. And of course, don't forget to make it fun, make it memorable, make it unconventional. So, Garrett, back to you.
All right. Well, this was fantastic. Thank you, ladies, so much. There's a lot here, and we do have a number of audience questions today. And in our limited time left, we definitely won't be able to get to all of them. However, don't worry, someone will respond to you through email to answer your question. So go ahead and ask your question, and we're going to get to as many as we can. So or maybe probably just a couple here in the time that we have remaining. Here's a quick question that came in that might be helpful for others is what is the PRC abbreviation?
Plan cause all cost readmissions. So those are for the patients that had an admission and then got readmitted within 30 days of that discharge date. So plan all
Okay,
cost readmissions.
wonderful. Wish all the answers would be that quickly. I know some of these will be more in depth, so we probably don't have a whole lot of time. By the way, I'm getting a lot of questions asking if you'll get the slides. Yes, we will be sending out a link to the recording and to the slides afterwards. But let me ask this one really quickly. Is any chance there may be additional trainings to address exclusions?
Up to you, Garrett. That's a possibility.
Yeah, no, that sounds great. Great question. And yes, we will definitely be doing some more of these. Next question here is, let's see, does DataLink provide a report that will give a list of past exclusions?
No, but that's actually an enhancement that we're currently working on. It has been created as an enhancement and submitted to for us to create that based on claims coming through for those diagnoses. Yes.
Great. Another quick question here is, and I apologize, I'm not the expert here, so, but how are NCQA HEDIS measures different than the CMS technical specs posted on the CMS website for Medicare Part C?
Very interesting that you would ask. I was recently at the NCQA conference. I think it was in November, and I was always confused myself. So NCQA does create those measures, but CMS does decide which ones they want to adopt, and sometimes they put a little bit of a twist on them, I would say. For example, I just mentioned NCQA decided to lower the age for colon cancer screening, where CMS still hasn't adopted that. They brought up the point many times and kind of posted it to CMS that they need to try and align. It makes it very confusing for the providers and the groups to not be able to know what they need to do because the NCQA guidelines are a little bit different than the CMS's.
Wonderful. Last question here. Unfortunately, we're running out of time. Maybe a couple really quick last ones here. Is does DataLink provide a dashboard template to track measure rates?
Measure rate. So I'm not sure I understand. Sarah or Michelle, do you know what they mean by that?
Yeah, so we do have a couple of dashboards. Specifically, we have a HEDIS summary dashboard that does let you track your measure rates, showing you a summary level view of how you're performing in each of those HEDIS measures, including those Part D measures. It also gives you your star rating collectively as well as for each measure, and then shows you really. My favorite part of the report is actually it shows you how many more gaps you need to close to the next measure. So yes, we do have actually a couple different ways through our dashboards that you can find that information.
Wonderful.
And
And
one thing that I'll quickly add to that, Garrett, is we also have within our dashboard, you can see your year-over-year trending, which is really, really nice because you can take a look back over a variety of years and see if you've progressed the way that you wanted to, or if you need to make some bigger changes. But yeah, and one of the slides that we actually covered today gave you a glimpse at what our HEDIS summary looks like, but it's a bit more all-inclusive than that. You can look at all the measures that are out there, especially the ones that are tied to your contract.
very good. Okay, I promise this is actually the last one, and then we need to wrap up, unfortunately. Is there somewhere to get a copy of the exclusion codes and definitions for those codes?
Yeah, absolutely. So first of all, they are part of the tech specs. So you would be able to see not only the diagnosis codes, CPT codes, or any DMEs, but if you actually Google advanced illness and frailty exclusions, you should be able to find a list. I know that Humana actually has on their website great resources. So if you Google Humana provider resources and then go to their website, type in HEDIS on the search, and it will take you to that page. And they have an amazing document with the guidelines for the advanced illness and frailty exclusion, how often they need to be reported. But it also gives you every single diagnosis code and HCPC codes that will exclude the member as well.
Great. Well, and we have questions just pouring in, and don't worry, someone will get to you through email, but unfortunately, we have to wrap up. This is such a great presentation. Thank you so much, ladies, for this material. Obviously, there's a lot here, and what's going to happen is we're going to send an email out to all the registrants. And there will be a link to where you can actually review the recording, and you can also download the slides. And then we'll actually also attach the handout to that email so that you make sure that you get it. But thank you all so much for coming. As we wrap up really quickly, I just wanted to encourage you all to head over to vbcexhibithall.com and check out the DataLink virtual exhibit booth that they have there. There's a good way to learn more about them, their resources, some of the stuff that they're doing. You can really educate yourself on what they've got going on, and then there's ways to reach out to them there. So I highly encourage you to do that. We've got a lot of resources there as well. And then finally, if you would like to reach out to the DataLink team directly, the information is here on this last slide, info@datalinksoftware.com, or feel free to reach out to me as well. I'm happy to facilitate an introduction. But thank you all again so much. Thank you to our speakers, and thank you all for spending your afternoon with us. Until next time, thank you for coming. Bye-bye.